In this video I'm going to explain the anatomy of the vertebrae. Overall there's 5 regions of the vertebral column. There's the cervical region, which is C1 to C7, and that's located in the neck. The thoracic region, which is T1 to T12, which is located in the chest area. The lumbar region, which is located in the lower back and goes from L1 to L5. And there's also 5 sacral vertebrae which are fused and 4 coccyx vertebrae which are fused, but I'm only going to be talking about the cervical, thoracic and lumbar vertebrae. The typical cervical vertebrae has a vertebral body, also known as a centrum, and that's the weight-bearing portion of the vertebrae. It also has a bifid spinous process, which means it splits into 2, and this is on the vertebrae C2 to C6, because C1 and C7 are atypical. It also has transverse foramina, which is the opening in the transverse processes, and that allows the vertebral arteries to reach the brain. It has laminar pedicles and transverse processes, which are collectively known as the vertebral arch. And the vertebral foramen is the opening where the pedicles meet. And collectively, the vertebral foramen are called the vertebral canal. The atypical cervical vertebrae are C1, C2 and C7. C1 is also called the atlas, and it has no body or spinous process, but instead contains lateral masses. And each lateral mass contains a superior and inferior articular facet. The superior articular facet will articulate with the occipital condyles, and that will form the atlanto-occipital joint, and that allows flexion and extension of the neck. And the inferior articular facet, located near the anterior tubercle, that will articulate with the dens of C2 and form the atlanto-axial joint, which allows rotation of the head. So C2 is called the axis, and it's also atypical. And this dens or odontoid process will articulate with the anterior arch of the C1 atlas. C7 is called the vertebra prominens, and it doesn't have a bifid spinous process, meaning that it's a single spinous process. So if you compare it with any of the typical vertebrae, you'll see that the spinous process splits off into 2, but on the 7th cervical vertebrae, it's a single spinous process. A typical thoracic vertebrae has demifacets at the side of the body, and those articulate with the head of the ribs. So at the side of the body there's a demifacet, and the head of the rib will fit into it. Also, it has costal facets, which are located on the transverse process at the side, and those will articulate with the tubercles of the ribs of the vertebrae T1 to T10. So at the side of these transverse processes are the costal facets, and those will articulate with the tubercles of the ribs. The spinous process is long and slants inferiorly, and it also has superior and inferior costal facets. The superior costal facets or demifacets joins the ribs to the top of the vertebrae, and the inferior joins the ribs to the bottom of the vertebrae. And it also has superior and inferior articular processes, which form facet joints with vertebrae below and above. So the superior articular processes will articulate with the inferior articular processes of the vertebrae above to form the facet joint. The atypical thoracic vertebrae are T1, T10, T11 and T12. T1, the superfacet, is not a demifacet, as it's the only vertebrae to articulate with the first rib. T10 has a single pair of whole facets which articulate with the 10th rib, and it doesn't have inferior demifacets, as it only articulates with the rib corresponding. T11 and T12 each have a single pair of costal facets, and those are located on the pedicles instead of the transverse process. So instead of being located on this side of the transverse process, they'll be located on the pedicles instead. A typical lumbar vertebrae has an articular process, and those will form the facet joints. It also has a long transverse process and a short spinous process. It has accessory processes, which are found on the posterior aspect of the transverse processes, and these will be a site of attachment for the deep back muscles. And the medullary process is located on the posterior aspect of the superior articular process, and that will also be a site of attachment for the deep back muscles. So on the posterior side of the superior articular process is the mammillary process, and that will be a site of attachment for the deep back muscles. And the accessory process is found on the posterior aspect of the transverse process, and that is also a site of attachment for the deep back muscles. And again, like the other typical vertebrae, it has a pedicle, a lamina, transverse processes which make up the vertebral arch, and it also has a vertebral body and a spinous process. The only atypical lumbar vertebrae is the L5 vertebrae, and this has a large vertebral body and a large transverse process. And this is because it's used for weight bearing and supporting the weight of the rest of the vertebral column. Because if you go back to the start of the vertebral column, the fifth lumbar vertebrae has to hold up the entire weight of the other vertebral column.